common diagnosis or thing that we see in the physical therapy clinic, either with CrossFitters or with construction workers or even individuals that are lifting up little children constantly throughout the day. It's my favorite part of the body to treat. Just a little insight for you there. And also one of our other therapists, Dr. Caroline Grady, she loves working on the shoulder too. So let's jump right in and give you a little bit of information about the shoulder. If you have any questions while we're going throughout the PowerPoint, feel free to put those in the comments. Elise is monitoring them. We can answer them at the end. Or also, if there's any exercises you might be doing right now or need some exercises for the shoulder, feel free to reach out to us and we can get those to you. We can tailor them a little bit to what you're feeling, but if you feel comfortable, you can come into the clinic as we are still open. We're all wearing masks, keeping 6 feet away from each other outside of the therapist and patient interaction. And just we can work with you on your shoulder if you're really experiencing some difficulty and some pain right now. Let's jump into the PowerPoint and start talking about the shoulder. A little bit about our clinic. We have 3 locations, Arden, East Asheville, and Woodfin. Currently operating right now is our Arden and Woodfin locations. We have a lot of specialty therapists that treat all different types of diagnoses that you would see in physical therapy. Orthopedics in general include the joints of the body, shoulder pain, hip pain, back pain. We also have specialists that do pelvic health. We have TMJ and facial pain therapists that can work with anybody that's having some clicking, popping, issues with their jaw. CrossFit and weightlifting is the area that I specialize in, along with Dr. Grady. Lymphedema, at this time our massage therapy is not running, but we hope to get that up and running pretty soon. The shoulder. So as you can see from these pictures, our shoulder is a pretty awesome joint. It goes through a lot of ranges of motion and provides a lot of movement or freedom in our body. But it can also be problematic if we have certain muscles or certain ligaments or anything like that in the shoulder that have become either tight or weak, or if you've had shoulder surgery. A little bit of shoulder anatomy for you. You can see in this picture the bones and the muscles and all the tendons and ligaments that comprise the shoulder. The scapula or the shoulder blade, a more common term. The humerus is your arm bone. Clavicle is your collarbone. And the thoracic spine is your mid-back. These are all areas that are comprised of the shoulder anatomy and all areas that we address and treat in the clinic. The primary muscles that are involved with your shoulder are your rotator cuff, which consists of 4 muscles. We'll talk in those a little more detail in the next couple slides. Your biceps muscle, which is in the front. Your triceps in the back, your trapezius, which we normally think of as just this top muscle, but it's actually a really big muscle that runs up your neck, down the back of your shoulder, and into your back. Your pec major and pec minor lie on the front of your shoulder. So all of these muscles work together to provide stability to the shoulder, to help the shoulder move in all the different directions that the body requires. All the nerves that innervate the shoulder come out of the neck, and they provide power to the shoulder. They travel through an area called the brachial plexus, which comes through the neck and down into the armpit. Another area that you could run into some issues with that we'll go into in some future slides. I really like this picture because it talks about what is required of the shoulder, mobility and stability. Mobility, you think of movement. So how well can your shoulder move? Can you reach overhead? Can you reach behind your back? Are you running into limitations with just general movement type things? That's what you want to think about when you're thinking of mobility. Are your muscles long enough to allow you to move in those certain directions? And then stability is what is going to counterbalance that mobility. And it is more you can think of in terms of muscle control and the areas that allow you to move but not get injured. So you need mobility and movement, but you also need equal parts of stability to allow the shoulder to lift things overhead, pick things up from the floor, reach behind your back, but be strong in those positions. Pick up your child, do a clean and jerk or a snatch if you're into CrossFit. So we look at both of those things when we're in physical therapy in terms of how mobile you are and how strong and stable you are. Some common shoulder injuries that we'll go through is shoulder impingement, muscular sprains or tears, which are normally of the rotator cuff and the biceps, and then any types of impairments that might come into the neck or the mid-back. Shoulder impingement, what does this mean? You can think of the term impingement as like a pinching sensation, and some people mainly experience this when you're moving through range of motion. So if you're lifting your arm up overhead or you're lifting your arm out to the side, you might get like a catch or a pinch. And if you look into this picture where the normal is right here, and then you see all these little red spots, this is a reduced space where tendons can get pinched. We see this very commonly in the clinic. It responds very well to physical therapy. A lot of times with shoulder impingement, no surgery is required. And it's a little more insight from the physical therapist to determine what muscles do we need to get stronger to get that head of the humerus, this bone, to not impinge upon the ligaments that are going through that space right there. Rotator cuff tears. These are some statistics for you about the percentage of the population of people that may experience a rotator cuff tear in their life. You'll see this little thing that says in imaging of asymptomatic patients. That just means you don't have pain. These are the percentages of people that have some type of rotator cuff pathology. So just because you have a rotator cuff tear doesn't necessarily mean that you're going to experience pain in your shoulder. You may experience some range of motion limitations or some weakness, but just keep in mind if you were to go get an MRI of your shoulder and they said, oh my goodness, you have a tear in your rotator cuff, and they might tell you what muscle that was in, doesn't necessarily mean that you, one, need surgery or that you're in a lot of pain. So just keep that in mind with imaging. These are the muscles of the rotator cuff. There's 4 different muscles. 3 of them lie on the back of your shoulder, and you have one, this is called your supraspinatus, your infraspinatus, and your teres minor. And then on the inside of your shoulder blade, if you were coming from the front portion, you have what is called your subscapularis. These 4 muscles work together to stabilize the shoulder, to help the shoulder move in different directions. So if you are lifting, reaching, pulling, they all have to work together to provide stability for the shoulder. Mild to moderate tears can heal with conservative management. That's what we normally see in the clinic. Now, if we do see somebody that comes in with what we would suspect as a more severe rotator cuff tear, that may require surgery if we're not seeing the results conservatively that we want to see, such as restoring range of motion, reductions in pain, and improvements in strength. And that's where, as physical therapists, we'll use our clinical judgment to say, hey, this isn't responding quite like our quote-unquote typical presentation of a rotator cuff pathology. One, we need to reassess, see if there's anything else going on that we may have missed. But if we are unsure and the patient is experiencing more pain or expressing more concern, that's where we may refer to say, let's go get an MRI. Let's see what's really going on to help you restore full function. Impairments in the neck and mid-back. A lot of times we don't think about the neck or the back in regards to the shoulder, but all the nerves that come out from the neck innervate the shoulder and are what provide motor function and power. So if there's any type of pathology, like a pinched nerve, a compressed disc in the cervical spine, or even into this upper part of the mid-back right in here, all of this flows into your shoulder. And then in this picture, you can see it kind of goes into the lower part of the shoulder and down the arm. So if you're experiencing anything in regards to numbness, tingling, radiating pain, which means you can feel it kind of shoot down your arm, that's where a full assessment would help determine, is this coming more from your neck? Is it coming more from your shoulder? Can we rule in, rule out certain areas of the body that may or may not be involved, and then be able to treat you in multiple parts of the body, not just look at your shoulder because you're experiencing shoulder pain. This little picture is pretty cool and interesting, and it's showing that in these red parts that you can see down the arms, into the chest, along the back of the arm, and into the shoulder blade, these are all areas that you may feel pain from these certain muscles. So if your supraspinatus muscle is involved, you may feel pain on the lateral outside of your arm, up at the top of your neck, and so on. If your deltoid is what's involved, this is where you would typically feel pain. The one that's pretty interesting is infraspinatus and subscapularis. They travel further, and in my experience, more patients will experience some numbness, tingling type symptoms with these muscles. So one we want to rule out, is it a disc or a nerve? And if it's not, we're thinking about the referred pain patterns of these muscles. And we know that the infraspinatus can travel all the way down the arm into the hands, and the subscapularis can do the same thing. You'll see some of these other ones also travel down the arm. So that's where, just as a skilled physical therapist, we're looking at these muscles and we're trying to determine, is it still just referred pain from the muscles themselves that are causing these radicular symptoms into your arm, or is there something going on with the neck? These are just up closer pictures of where the muscle is actually located. So this is where your supraspinatus is with these two little X's. This is where your infraspinatus is. But then the red areas are where you might feel pain. The darker red is more commonly where most people feel pain, but then you can see lighter, you can also get some symptoms into other areas. Same thing, subscapularis, where it's located, where we palpate it at, teres minor, and then areas that may cause discomfort. Posture, that's a pretty hot topic, or a common thing that we all talk about. How does that influence the shoulder? So I wouldn't say in general that if you have bad posture, you're going to have pain, or if you have really good posture, you're not going to have pain. They don't correlate. In general, we want to think about our posture, and we want to be aware of how we're sitting. In this picture, not very ideal. Texting on the phone, you can see these muscles get shortened. These are elongated. They pull into the shoulder. It's just something we address in the whole paradigm or picture of physical therapy, especially if you do spend a lot of time on your computer, if you are on your phone a lot for work, if you have to do a lot of driving, things that you want to be conscious about. But we'll hear patients say, I'm trying really hard to keep my shoulders back, keep my neck back, and I just can't do that. Well, the reality of it is none of us have perfect posture all day long, and none of us are going to be able to sustain that all day long. But if we can get the muscles in the front of the neck, the back of the neck, posterior shoulder stronger, and lengthen the muscles in the front of the shoulder, which tend to pull us forward, we can find ourselves in those better postures and able to withstand that and sustain those postures for longer with less pain, because we're addressing the areas that need to be addressed to keep you in that position. This is a good little picture of how an ergonomic setup should be, either at your office or at home. I won't go through all the little numbers, sorry. But you can see where your screen should be in relation to your eyes, because that's going to help protect your neck, where your keyboard should be in relation to your arm. That's going to keep the shoulders down. You don't want to be overstraining to reach for your mouse or your computer screen be slightly off to the right or to the left, because that's going to put the neck at an angle all day long. Things to just think about as we are spending more time at home, doing more telehealth or doing more Zoom calls. Set yourself up for success. It doesn't mean that it's going to eliminate all of your discomfort because you have this perfect ergonomic setup, but it's not going to hurt to get things in a better position, especially if you're spending more time in that position during your day. Couple questions that we all ask ourselves, or as physical therapists, we would say, what would you want to do about your pain? We definitely don't want to ignore it or just try to use your other arm. A common thing that we'll hear when somebody comes in physical therapy, man, my right shoulder's been killing me. My left shoulder actually feels a little bit sore now because I've been doing more stuff with it to protect my right shoulder. Very normal. That's what our body does. It's going to figure out ways for you to still move because something hurts. So you're like, well, if I can't reach up with my right arm to get that plate from the top shelf, then I'll just do it with my left. And then you can run into an overuse injury on the uninvolved side. Other things we can do in terms of pain is we can try to alter or mask it. Cortisone injections can reduce inflammation. It does not address the underlying cause. If there was a torn rotator cuff muscle, a labral tear, any type of impingement, it's not going to make that go away, but it can reduce the inflammatory response in the area. And sometimes it's very helpful in physical therapy if we have a patient that has had a cortisone injection. It can kind of break through some of those barriers, reduce the inflammation, and we can gradually restore a little bit more range of motion and work into that newer free range we have because we've reduced inflammation. Pain medications, ice, heat, TENS unit, all different things people might use to alter or mask the pain that they feel. I myself would say, why not try physical therapy? It's a really good option for a lot of patients with shoulder pain. One, we want to keep you out of surgery. Most people would not want that to be their first option. And as physical therapists, we want to direct patients who do need surgery along that path, but patients that don't necessarily need it, and we can treat that conservatively to see if we can restore their motion and help them have better quality of life with lower costs, avoiding surgery, minimal side effects to physical therapy, some soreness that you might experience, and a specialized treatment plan. So the specialized treatment plan, what does that include? A question that people might wonder when you come into physical therapy. We just want to look and see how you're moving initially. So at that initial evaluation, we want to see how high can you raise your arm? How far can you reach out to the side? Are you able to reach behind your back? Then we're going to do more of a strength assessment. We're going to look and see how your joints are moving. Then we will also want to discuss things that affect your everyday life. What type of exercise do you like to do? Can you not do right now because of your shoulder? Do you want to get back to? Is your sleep impacted? If we tend to like to sleep on our right shoulder, but your right shoulder is causing you some pain, you might not be able to sleep on that side right now. Or you also hear from patients, it feels better to sleep on that side. So we're trying to figure out, why is that? How's your neck position when you're sleeping? We need to look at your pillow setup because, as we talked about before, your neck plays into your shoulder. Is it impacting just your overall quality of life? A lot of us right now are not spending a lot of time with friends, but it may be impacting your home workouts, your quality of work. We just want to talk about all those things to individualize that plan of care to you to get you back doing the things that you want to do. I talked about this, things that are included in PT. Joint mobilizations is where we work on the joint as the physical therapist. You're not doing much. Sometimes we incorporate movement with that from the patient. Soft tissue massage, dry needling, a lot of different things we can incorporate into your plan of care to get you to reach your goals. This is just one corrective exercise that we more commonly prescribe for patients with shoulder pain. This is going to help strengthen the rotator cuff and the shoulder blade muscles. It's going to promote one of those exercises that you would say is going to help me have better posture because we're getting the muscles in the posterior aspect of your shoulder stronger. The other things we think about is stretching tight muscles and joints. If this is the exercise you're currently doing and you're running into some pain or some issues, or it's just getting really easy, reach out to us. We can update it. We can talk through some things. Elise is right here. She's monitoring the comments, so feel free to drop that in there if you have a question about it. We talked about a postural assessment, a little more details that we look at when you come in. What is your sitting posture, your standing posture? What do you do for work? Are you at a desk all day? Let's talk about the setup for that. Are you driving in your car? If you have that car with you, let's walk outside, take a look at it, maybe make some adjustments to your headrest, to the seat, to the steering wheel. Talk through some things, because if you do have to spend a lot of time in your car, we need to make sure that's as comfortable as possible and it's not actually causing you increased symptoms in your shoulder or neck. So right now, we currently have 3 different options for you. You can come into the clinic for an evaluation. Like I said, our South Asheville and North Asheville offices are open. We have been deemed essential, so we are here for you. We are wearing masks. We want to be here to help you get through this time. Hopefully our stay-at-home order might be lifted pretty soon. And if you're feeling comfortable, we have about 50% of our patients back in the clinic now. So call in, schedule an evaluation, and we can get you rolling with your plan of care. The other thing we're doing right now is some telehealth visits. Not sure right now as far as evaluations. If you're a current patient and you don't want to come into the clinic, we could schedule a telehealth visit. We could talk about if an evaluation will be covered, and that's where our billing department can run your insurance benefits. If the stay-at-home order is lifted on this Friday, May 8th, we're not sure if insurances are going to continue to cover. We know Medicare will. Private insurances, we haven't heard much from them yet. So that's where we're going to kind of have to take that on a patient-by-patient basis as far as coming into the clinic versus doing telehealth. Start with some education and exercises. You could give Elise an email or drop her an email. You can see it right there on the screen. If you have any questions, any exercises that you're running into that you're like, I'd like to talk to a therapist or I'm really not sure, shoot her an email. She will be happy to respond. Any questions? All right. I don't think we have any questions. So at this time, you can go back and review this PowerPoint as you need to. It'll be on Facebook live streaming. You can rewind it. You can re-listen to certain parts. Once again, we're in the clinic. We're here to help you. Reach out if you need us. Hope y'all have a great day. Thanks. Bye.